Hi, and welcome to our channel, Chat GLP. We are not doctors, and this is not medical advice. This channel was created for us to share as patients who have the disease of obesity and are using GLP medications to treat this disease. My name is Claudia, and I have the disease of obesity. I have started to use this medication since June of 2025. I am on terzepatide. I am currently on the maximum dose of 15 milligrams. And one of the reasons I wanted to make this video today was to share some of the current issues that I'm dealing with. A couple of days ago, I had an appointment with the sleep doctor, specialist in sleep, and I had a sleep apnea done at home. I did the initial appointment over a telehealth visit with my doctor. She did prescribe the sleep apnea test because I described some of the symptoms I have been having. Um, and after the sleep study, she um, told me in our follow up appointment, the post test appointment, she let me know that the results came back that I have moderate sleep apnea. And I asked for some details on what I can do. And of course, she recommended to use a CPAP to manage the disease of sleep apnea. So ever since, I have been even more careful monitoring my sleep. I do use a watch to record my sleep patterns. It gives me feedback on respiration rates while I sleep, heart rate. And I have noticed that on the days when I wake up tired, when I wake up in the middle of the night, which is fairly regularly, um, I notice now that when I have appetite, um, hunger in the middle of the night, it's usually when the sleep apnea is at its most or at its worst. So I'll go back and look at the results from the my watch that monitors my sleep every night. And I notice that on the days where I wake up more, those are the days where the sleep apnea has been more elevated on the respiration rates. And I noticed I started to pay attention to that pattern relating to being hungry in the middle of the night. So maybe this does not happen to every patient that may have sleep apnea. But now that I know that I have the diagnosis of sleep apnea, I am putting the pieces together, putting the puzzle together, and it now makes so much more sense that as I read up and looked up and confirmed by the sleep specialist doctor, she confirmed that sleep apnea can affect appetite and our hormones, and our appetite is basically controlled by hormones as well. It's by our brain, by our hormones, etc. So for me, this has been a very eye opening week because I feel that there is a definite pattern between me not getting a very good night's sleep. A moderate to poor night of sleep triggers a significant spike in my hunger, even if I am in terzepatide 15 milligrams. And so it just finally clicked for me. It finally made sense. Waking up in the middle of the night, feeling hungry, and now being able to see, okay, it's very obvious to me. The pattern is there. The sleep apnea is, if not the root cause, one of the very significant causes of the appetite that I feel is tremendous, even on terzepatide 15 milligrams. Um, so the encouraging news is that my doctor told me that for many of her patients, once they manage the sleep apnea using, obviously, terzepatide is one of the ways that I'm addressing it because terzepatide is prescribed for sleep apnea. So I'm very glad for that. But I'm also going to work on what she recommended to use the CPAP. And she said a lot of her patients, once they manage the sleep apnea, will improve on their weight loss journey. So I'm looking forward to getting my sleep apnea machine in the next couple of days, and I will share the update of how it's affecting me. One, does it work for sleep? Is it helping me to sleep better? Um, I will continue to monitor my sleep with my watch, and I look forward to giving that feedback of how I feel. One, with sleep, and two, with the appetite management. Um, because I also read up online, I looked it up, and I also noticed that having sleep apnea can affect how my body uses hormones, whether it's my own hormones or if I'm getting HRT, which I am. I am in perimenopause and I do take estrogen and progesterone to help me to sleep better. And one of the wonderful things that just happened in the last few months, um, I started to work with a new HRT doctor. And when they increased the level of estrogen, it made a huge difference because I was having heart palpitations. And that pretty much has managed it 99.9%. So I feel so much better already. And I can't wait to see and report back how the sleep apnea helps me because I am receiving the education from the sleep doctor, from looking it up on how the body is affected with sleep apnea for even for my hormone usage. So there's, from what I can understand, a double fold or even triple fold benefit to me managing the sleep apnea for the weight loss, for the all of the complications that come with sleep apnea from disruption in how my brain functions because the oxygen does get lower at night. So I'm looking forward to that, getting better rest, um, and how it can help to improve the way my body uses my hormones. Again, whether it's the hormones that my body takes or the hormones that I take for hormone replacement therapy. So there's lots that I'm looking forward to. Um, Again, I'm already feeling much better with having an increase on the estrogen and having the heart palpitations completely 99% managed. I don't want to say 100, but almost completely managed. So that has been a tremendous benefit to my health. And there's just, I'm very happy, I'm very grateful, even though it's been a frustrating week. This is frustrating, the whole path. Like I've mentioned before, I am losing weight slowly but consistently, but I do feel it has been a bit slow, and I'm okay with that. Again, I also understand that I would rather take the slow, healthy route than have other complications of muscle loss, bone density loss, etc., etc. So I am happy where I'm at. I do feel some frustration, but I am excited to report in the next maybe 2 weeks or so after I get the machine on how it affects all of those things. Thank you so much for watching. I hope that you are feeling not alone in this journey. That's why I created this channel, to share the good, the bad, the challenges, so that you don't feel alone. The and the other purpose of this channel is to encourage you, now that you know that I'm going through these things, that I've had sleep apnea and it's been diagnosed through a sleep study. If you suspect that you're having a very big appetite and you've struggled with keeping the weight off, I've lost weight many, many times, but I have not been able to successfully keep it off. And that's where this medication can and is helping me now. So, again, thank you for listening. And I look forward to continuing to share all of these happy and frustrating experiences, hoping that they will um, educate you, empower you to have these conversations with your doctor. Thank you for listening, and please remember to like and subscribe.